Hi friends, on today's class we are going to see about the valvular heart disease which is known as tricuspid stenosis. Okay, so tricuspid stenosis. So I have already told you that stenosis is nothing but fused, thickened and narrowing of the valve which causes normal flow of obstruction. Okay, so normally we have left atrium, left ventricle and aorta. Okay, and in the right side, right atrium, right ventricle, and we have pulmonary arteries here. In this pulmonary artery leads to lungs. In this lungs, okay, this lungs then have a pulmonary vein. Okay, so the pulmonary vein which directs it to the left atrium. Okay, now the tricuspid valve is present between the right atrium and the right ventricle. Okay, now this valve become narrowed like this and fused and thickened, and hence the normal flow of the blood from the right atrium to the right ventricle is not proper. So what happens? Normally right atrium, right ventricle, tricuspid valve. So this abnormality is that it is caused by a rheumatic heart disease. Okay, it is caused by rheumatic heart disease. It will not separately be defected. Okay, and it is associated with aortic stenosis and mitral stenosis. Usually it is associated with aortic stenosis and mitral stenosis. Okay, and then the pathophysiology here is, see, when this valve get narrowed, what happens? The blood flow is not sufficient to the right ventricle and thus it does not allow for the oxygenation and cardiac output will be low. We know that. So the right atrium pressure increases, and what happens? This leads to increase in systemic pressure. Okay, the systemic pressure will get increased in systemic pressure. Okay, so the right atrium pressure increases, left ventricle blood flow get decreased, and the pulmonary artery was not getting the blood, and the cardiac output is decreased. So this is what the pathophysiology take place here. Coming to symptoms. Symptoms, normally when the right heart gets failed, the normal symptoms are hepatomegaly, okay, enlargement of liver, and we have ascites, fluid accumulation in the abdominal cavity. So ascites, and the third one will be peripheral edema. And increased systemic pressure will be seen. So these are the symptoms which we take part in the tricuspid stenosis. Whereas signs, what the doctor has diagnosed, and he was able to capable to know that the patient has increased jugular venous pressure. Okay, signs will be increased jugular venous pressure. And in the symptoms there will be an enlargement in the neck vein. Okay, so neck vein get enlarged, neck vein enlargement will be take place, and jugular venous pressure will be increased in sign, Okay, and there will be a mid-diastolic murmur. Mid-diastolic murmur will be take place here. These are the signs. And what are the management we can able to see is we can give as aortic stenosis, mitral stenosis if it is associated. We can give any diuretics, digoxin and anticoagulants to reduce the risk of systemic embolism. But tricuspid stenosis always they have a surgical management. Okay, like surgical management like valvuloplasty, balloon valvuloplasty, okay, balloon valvuloplasty, valve replacement, and we have valvectomy. Okay, so these are the management which can be done, and this is the definition, pathophysiology. Okay, pathophysiology and symptoms, signs, cause, rheumatic heart disease. Okay, and at last we get a management. And this is for the today's video. On next video I will see the next valvular disease. Until then, take care, be safe, bye. And this is Nandu, bye.